It's a tiny, tiny school. Lots of strong community here. It's a fabulous, fabulous school. This is my 8th year as a school nurse. This is my 2nd year as a school nurse here at Continental, and I'm really blessed to be here because my son is a student here. My son is a 3rd grader here. But last year when I came to Continental, I was very lucky. I'd worked in a larger school district before. I'd worked with a very strong health office. So when I came here, I was used to working with a team, and I came here and I was solo. I was by myself, which was a little tough. The school had been here 100 years, but the health office really needed some work to be put in place. So it was a lot of trying to get an epinephrine program in place. There wasn't much in place. There weren't a lot of forms in place. And it was a busy office. I didn't realize how busy it was until the end of the year. I did a count on how many kids we'd had in our office. We had 5,607 visits in our office last year. The kids are here 174 days a year, I believe. I work 7 hours a day. So it's super, super busy. We have anywhere from, I think last year we gave about 15 medications a day. This year it's been a little less, anywhere maybe from 7 to 10 a day. So kids come in for scheduled visits, but the school nurse sees everything. We see playground injuries, we see kids that need reassurance, kids that are sick, acutely ill, acutely injured. And then of course we have our regulars that we see. We have, on this campus, we have 68 known asthmatics. We have 9 students with life-threatening anaphylaxis. We have 1 student with type 1 diabetes, fairly newly diagnosed. On our little campus of 600 children, we have quite a large special needs population. We have 2 students that are tube fed, 1 newly diagnosed student with diabetes. We have 68 known asthmatic students on our campus, and we have 9 students with life-threatening anaphylaxis. So we have 9 EpiPens on our campus at all times. So it's a very, very busy place. Yeah, and the office is busy. I think one thing we see here being in Green Valley is we are close to the mines. And of course the mines are in use all the time, but when we have the wind blowing, you will have that mine dust that blows into the area, and that can certainly exacerbate a student's asthma. Also, something I never even thought about, but we have the pecan trees here, the pecan groves. And every year in the springtime, they sort of shake the trees, and this creates a lot of dust. And of course, we have a lot of students with anaphylaxis and with asthma, and that's super irritating to them. And then of course, just seasonal allergies, we see a lot of that. But that's sort of what we see environmentally. We have some students that are scheduled for, they pretty much come daily, or some of them are, we had a student who came daily who was a really severe asthmatic. And the mom was really good. She would call us in the morning and she would sort of give us a report. But she was a child that we saw almost daily for her asthmatic needs. We have another student that we see twice a week, and she's seen before PE. PE seems to really exacerbate her asthma. So those are scheduled asthmatic visits that we have. Yeah, so the mine dust is big here, being close to the mines, and we have the pecan orchards, which who knew, but that's a huge trigger for both our children with anaphylaxis and asthma. And just seasonal, it's windy a lot, so you have a lot of wind and children are out. Of course, children want to play all day, and that exacerbates their asthma too. Last year, so this was my first year at Continental last year, I had 6 911 calls. 3 were respiratory distress. I believe 2 out of the 3 students were known asthmatics, and they just either didn't have an inhaler here or forgot it at home. So we ended up having to call 911, and all 3 of the students were treated here. The paramedics treated them here with albuterol. I believe 1 student was taken to the emergency room, and the other 2 were taken home with parents to a physician's office. But it's really scary to be a nurse and to not have anything you can use on a student with asthma. It is heart-stopping. So the albuterol program that we started this year is phenomenal. This year we've only had 2 911 calls, and those 911 calls were more orthopedic injuries. We have had 0 911 calls due to respiratory distress. This year we've used our stock inhaler 5 times. I believe 3 of the students were known asthmatics to us, and again, either where was their inhaler? It was on their bedside table at home. They had forgotten their inhaler. I had one student in whose inhaler had run out, and the parents hadn't been able to get that prescription filled. So those 3 were known asthmatics that we could treat, monitor, and they were good to go back to class. We had 2 other students that we used the inhaler on, and these were both students with known, both of them have anaphylaxis, asthma, and eczema. And when I met with the parents earlier in the school year, I said, how's their asthma doing? And the parents all said, oh, their asthma is doing pretty well. And lo and behold, I had 2 of them in here with, I can't breathe. I'm having difficulty breathing, my chest is tight. So we used the program with them as well. And those 2 students, parents of course were called in that case, and they were both taken home or to the physician's office, but again, no need for 911. So the program it's been a godsend. It's been phenomenal. There was one student that I did use the inhaler with, and I think she had an upper respiratory infection. I think she ended up obviously seeing the doctor after, but she came in with, I'm having a lot of she was hyperventilating, a lot of difficulty breathing. You could hear, when you put a stethoscope on her, really, really congested. Used the inhaler on her. Mom came, used the inhaler, and Mom took her to a doctor's office, and I believe she was diagnosed with bronchitis at that time. But she was really sick. She was a really sick kid. And again, I would have had to call 911 in really all of those situations without having the stock albuterol program. So it's been huge. We're pretty lucky. We're such a small community, and majority of parents are here in the community, and we're very lucky. It seems like there's many moms that are at home, so I've been very lucky to call a parent, and they're generally here maybe within 10 or 15 minutes. But there have been instances where we did have one student with the anaphylaxis and asthma history. Both parents were in Tucson. Mother worked in Tucson and Dad was in Tucson. So that was a little hairy, we had to wait probably 45 minutes for a parent to get here. But having the program, we followed the protocol, monitored the child closely. He was doing fine, and by the time parents got here, he was actually back to his baseline. He was doing fine. So recently I had a child who was newly diagnosed with asthma, and they had been taught very briefly in the clinic. And the mother came in and she said, could you teach my child, for the first week, they want to carry their own inhaler, and I think they're capable of carrying their own inhaler, but could you for the first week instruct my child and ensure that they're doing this correctly? So that's I think the advantage we have here in the school system. The kids know you, they trust you, so you can really spend time with kids, and we can really do some good teaching with a child, really showing them this is the spacer, this is how you use it, this is how you prime it, so they really understand the techniques. And we also talk a lot about safety in the school system. If students are carrying their own inhalers, we want to make sure that they are following their physician's protocols. I give an in-service to the teachers at the start of the school year, making sure teachers know who has asthma in front of them, knowing who is carrying an inhaler, who is an inhaler in our office, knowing that we have the stock program here. So if we have anybody in respiratory distress, they're to call, and we can move on that quickly. But I think there's we're actually able to spend time with our kids here and really educate them well on what asthma is and how to use their inhalers properly. So here at the Continental Health Office, we have, if a student comes in with respiratory distress, we have our protocol up on our walls for quick access. But we have everything. This is sort of our to-go bag that I use. So we have, emergency diabetes supplies in here. We have our stock epinephrine in here, and of course our stock albuterol in here. So we have the spacers that have been provided to us, and we also have our protocol in here as well. So if I had to go to a classroom or if I had to go to the track, we would have that accessible So that's on us at all times. And this would be something too, if EMS arrived, it's something that they could take a look at. So we have, in our little health office here, we have a medication administration record, our logs where we put our daily medications in. And we also have our doctor's orders and our action plans. So any asthma action plans would be in here, as well as anaphylaxis action plans, diabetes action plans. This is our stock albuterol folder that we use as well if we use the program. So in this folder, we have several pages of standing orders for our district that are signed by our medical director. And then we also have our standing orders for our epinephrine program. So we have that in here. And of course, we have our stock albuterol program. We have our standing orders in here as well. So if the state walked into my office, we would be in compliance. So we have that. And then our stock program, we do use this folder if we have a student that has used the program. We do, of course, document. We follow, let me find the page. We follow the log here with the student's name and any information that's requested by the albuterol program. And this year we have several pages of kids that have used this program successfully. And so far at our school, it's myself and I have a health assistant. We both took the training test and could work on this program.